Hello, my name is Carolyn Gray and I'm a third-year psychology student. I'm currently enrolled in a Behaviour Modification unit at the University of New England. Behaviour modification involves the analysis and modification of human behaviour. Hair pulling, classified as an impulse control disorder, is one such behaviour. Hair pulling involves the conscious and unconscious removal of hair from anywhere on the body, resulting in noticeable hair loss. The individual will often feel tense or anxious prior to an episode of hair pulling, followed by a sense of relief or satisfaction once the hair has been pulled. Hair pulling can have a profound impact on the psychological well-being of the individual, who will often feel embarrassed or is socially isolated because of their behaviour. In this presentation, I'll discuss 2 behaviour modification strategies that can be used to modify hair pulling behaviour. First, information is gathered on the client's history. For example, how long have they engaged in the behaviour, and have they sought treatment in the past? In addition, the client would be asked to complete the Massachusetts General Hospital Hair Pulling Scale. This is a 7-question self-report assessment that identifies the intensity, the frequency, and the feelings behind the hair pulling. A self-management plan is then developed. This involves the client setting a goal for reducing the hair pulling. A functional assessment is then conducted that identifies the antecedents, the behaviour, and the consequences that reinforce the hair pulling. The functional assessment takes 5 weeks to complete. In the first week, the client records the target behaviour on the functional assessment form that includes information such as the date, the time, who was present, what happened before, or the antecedent, the behaviour, and the consequence, which is usually the reinforcer for the hair pulling, and any other comments that the client might like to make. The information gathered helps to identify suitable treatment strategies and also acts as a baseline reference point for monitoring the client's progress. Well, what are the treatment strategies that are suitable for hair pulling? Evidence-based research has identified differential reinforcement of competing response as well as awareness training. Differential reinforcement of competing response involves manipulating the antecedent by using a competing response to the hair pulling. For instance, the client would hold their arms by their side and clench their hands to make a fist and hold this position for 3 minutes instead of pulling their hair. Alternatively, a soft malleable ball could be held in the hand and squeezed for 3 minutes. Reinforcement occurs in the form of praise for resisting attempts to pull the hair. Praise can be given by social support, such as a partner or a friend, or the clinician via text messaging. Awareness training involves bringing awareness to unconscious and conscious episodes of hair pulling. The client would describe the antecedents that lead to the behaviour, such as playing with their hair, or feeling bored or feeling stressed. The consequences that reinforce the behaviour could be enjoyment in finding the perfect hair, or a reduction in stress or tension, or even a feeling of satisfaction. Ideally, the alternative behaviour needs to be something that the client will engage in whenever an urge to pull the hair occurs. Alternative behaviours or strategies are discussed and implemented with the client in a 1-hour session prior to week 2 of the functional assessment. From week 2 to week 5, The client uses the functional assessment form to record the number of hairs pulled in a day. This information is text messaged to the clinician, who will praise the client for achieving the target goal. Praise also needs to be given for attempts to reduce hair pulling, with an emphasis on what could be changed if the target cannot be reached. For instance, treatment strategies or alternative behaviours may need to be reviewed or modified. Implementing maintenance strategies for maintaining alternative behaviours is also important in the recovery process. Ideally, this would be natural contingency reinforcers such as praise or feelings of personal well-being for the client. In addition, the client may sign a contract or be offered a predetermined incentive or reward such as money. Recovery may take some time and require regular assessing of progress in implementing alternative behaviours. The benefit, however, will be one of improved life and well-being.